Hello and welcome. My name is Dr. Martina Assad, and I'm the owner dentist of MA Dental. We are located on Van Buren on the 215 South in Riverside. And today would like to answer any questions you may have concerning the 3D imaging scans or CBCT. What are the CBCT scans and how is it different from traditional X-rays? And then it's simply speaking the 3D imaging scans, it goes around your head. You stand in a little machine, you go around your head, and then it goes in 360 version, and then it kind of laser beam on your tooth, on your face, on your jaw, depending on what we're trying to do. In all, it's like a three-dimensional version of what there is, versus traditional X-rays. They're just taking it from direction front to back, which doesn't show as much as a CBCT would. Um, Overall, we used a combo of both to try to diagnose and make sure like we're not missing anything. What would make a 3D imaging scans or the CBCT useful in dentistry? And the answer is if there is a hiding infection, especially on old root canals, if there is a tooth that is having an abscess or pus that is coming out, or if there's a filling root canal, or if there's an area we're trying to build to restore for an implant, or there's a lesion in the jaw that is not necessarily detected on the normal 2D images, a CBCT would be definitely the choice of X-rays, just to complement what we have done so far with the regular X-ray. When would the dentist recommend the CBCT scans for oral health evaluation? Sometimes if a patient has a jaw issue, or if the patient has an existing infection or a lesion or an abscess or pus coming out of some sort, is a great idea. For old root canals and the health of implants is also a great idea. To build areas like build bony areas or lift sinuses for, again, implant placements, it's a great idea. Just to check for lesions and check for pathologies or like, God forbid, oral cancers, especially in the bone, that only usually shows on a CBCT or a panel. How does a CBCT is used to plan for advanced procedures like implants? So first of all, you stand into the machine goes around your head 360, and then the image that gets superimposed on the digital scan, we have a camera in the office that we take a scan of your mouth for it, and a lot of times these files get sent to the labs or the appropriate printers, and so both files start to merge, so we can use it for the purpose of planning for a major case like denture supports on implants, or it does depend. It's mainly for planning purposes and make sure like we're not doing blind techniques. What does a patient would expect during a CBCT appointment? First of all, you do not want to be wearing anything from the neck up, and if you do, we will ask you to take it off, and you will be shielded, and then you'll have to stand straight in the machine. Being claustrophobic doesn't help. We will try to help you through it, or if you can't stand, usually we'll get you a chair to a proper height to sit, especially if you're like an older patient. And then you just have to stand still, follow instructions, and then the machine would go around your head, and when you're done, you'll be escorted back to your room. Are CBCT scans safe? And absolutely they are. We do it for kids, we do it for adults. The only patients that I do not necessarily absolutely jump into conclusion of taking one is pregnant women, and if that's the case, then it's absolutely necessary. We will double shield you. But are they safe? Yes. Is it done on a daily basis? Yes. Can CBCT scans detect issues on teeth beyond the normal x-rays, like infections or something weird looking that is going on? And the answer is absolutely yes. This is one of the main reasons why we gravitated toward to take a CBCT or a Panorex image, just to make sure like everything looks normal, and if it looks abnormal, then we take the appropriate measures and we would take care of you. What would a patient would look for when they're choosing a dental provider with the CBCT scans? First of all, they would be looking forward for cleanliness and promptness your dental provider need to listen to your concerns. If it's an infection related, or if it's issue related with a root canal, or the previous issues we've spoken about, it is super important for your dentist to recommend a CBCT scan. And if they don't have one, which we don't, we do have one in our office that we use on a daily basis. But if your provider doesn't have one, they usually have something called mobile clinics or mobile CBCT scans, where the dentist would actually have the mobile van come in and they would take the CBCT scan for you. Or sometimes the dentist would refer to a nearby lab that have a CBCT scan. The most important part is if it needs to be taken, then it must be taken. Otherwise, a specialty referral would be necessary. That concludes the end of our CBCT video today, and I hope I was able to answer many questions you may have. If you would like to hear more, or if you'd like to be a patient of our patient basis, please do not hesitate to call us back at 951 327 7247, and I'll be more than happy to see you and schedule an appointment.